U.S. healthcare needs fixing, but there's no agreement on how to do it. Jeff King was recovering from an unexpected procedure to fix his irregular heart rhythm when he received shocking news. The hospital had given him a $160,119 bill for the treatment. King, a former pastor, did not have standard health insurance from his employer, only a cost-sharing alternative plan that said it would not cover the procedure. "It was pretty traumatic," said the 66-year-old from Lawrence, Kansas. "Who knew that less than a NADE procedure in and out of the hospital could destroy us financially?" King is one of around 100 million people, or about 40 of Americans, who are estimated to struggle to pay off their medical and dental healthcare debt, according to recent data. The healthcare company King was a member of have previously said it's important that members understand its cost-sharing model and membership guidelines. The U.S. has one of the most expensive health systems in the world, with spending on healthcare estimated to reach 5.9 trillion tons, 4.3 trillion tons in 2026, according to the Centers for Medicare and Medicaid Services. But despite spending twice as much per capita on healthcare compared with wealthy nations of a similar size, the U.S. has a lower life expectancy than those other nations, according to health research nonprofit KFF. As costs have continued to grow, so have Americans' frustrations with the U.S. healthcare system. In December of 2024, a gunman fatally shot United Healthcare CEO Brian Thompson, a father of two, on a busy street in Manhattan. Some took to social media after the murder to celebrate the alleged assassin, Luigi Mangione, as a kind of folk hero, believing Thompson's killing to be a reaction against the system. Supporters of the murder suspect flocked to stand outside the courthouse in New York for his hearings, wearing backpacks and shirts saying "Free Luigi" and carrying signs protesting the healthcare industry. Last Friday, a judge threw out a federal firearms murder count against Mangione, which was punishable by the death penalty. Karen Friedman Agnifilo, one of Mangione's lawyers, thanked his fans after the judge's decision, saying, "We really appreciate all the support." For years, both Republicans and Democrats have recognized a need for reforms to a costly and convoluted system, but have disagreed on the best solutions to fix the problem. President Donald Trump recently proposed his own solution, the Great Healthcare Plan, which suggests sending citizens money directly to help pay for health insurance. He added the Great Healthcare Plan, it's great healthcare at a lower price, mandates unprecedented accountability and transparency from insurance companies and all healthcare providers so that special interests can no longer profiteer at your expense. But experts say the plan is light on actual details, including how much money Trump wants to send people and how he would fund his plan, and that the recent expiration of subsidies and cuts to government health programs under Trump could make healthcare even less affordable. Large publicly traded health companies have tripled their profits over the last 2 decades, paying out shareholders over 2.6 trillion tons from 2001 to 2022, according to a study in the Journal of the American Medical Association. "We are the only major health system in the world that allows the free market to run loose," said John McDonough, Harvard T.H. Chan School of Public Health professor. "We have lots that really could be fixed and changed, and what's mostly missing in the U.S. is the political will to achieve the change." Despite its shortcomings, the majority of Americans prefer the private healthcare system the U.S. already has to the idea of a government-run system, according to a recent study from Gallup, which found 53% prefer a private system. But for all the acceptance that the U.S. healthcare system is broken, is there the political will to fix it? Or will fresh attempts at reform fall short of ending the health horror stories that,